hypertension is the principal cause of premature cardiovascular disease in India, and hypertension is very common in the society. Unfortunately, hypertension is poorly controlled in clinical practices. I urge all of you to control blood pressure very aggressively in your clinical practice. The goal level of blood pressure in your patient should be 130 or 80. You can do that with non-pharmacological treatment or pharmacological treatment, or a combination of lifestyle changes plus pharmacological treatment. According to the guidelines, to achieve the goal levels of blood pressure, one should take advantage of the fixed dose combination therapies that are becoming available. For example, among the fixed dose combination, both the guidelines have suggested an angiotensin receptor blocker plus a calcium blocking drug plus a diuretic. An example of angiotensin receptor blocking drug would be telmisartan. An example of calcium blocking drug will be amlodipine. An example of a diuretic will be chlorothalidone. All these three drugs have shown to be extremely beneficial in various outcome trials that I have narrated. So when you combine them, ladies and gentlemen, I do expect there will be a greater benefit in your patients with hypertension. Not only you will be able to achieve goal levels of blood pressure very quickly, but the clinical outcome is also going to be much, much better. It has been said that one should achieve the goal levels of blood pressure when you start the treatment within 3 to 6 months of treatment. And how do you achieve this? The best way to achieve the target blood pressure levels in clinical practice is to use fixed dose combination therapy for hypertension. Do not hesitate to use them. They are safe, they are well tolerated. You will be happy with the results, and most importantly, the patients and their families will be happier because the blood pressure is under control and they have freedom from various complications from hypertension. Thank you very much for your attention, and all the best in your clinical practices.